Okay, looks like we got a number of people logged in, so we're getting ready to get started here. My name is Mike Conroy. I'm the Director of Group Benefits here at Walsh Duffield, and I welcome you to the Post-Election Healthcare Landscape presentation. It's going to be presented by Roberta Rifkin, Senior Vice President of Government Programs. Before we get started, I do want to go over a few housekeeping items. The webinar is being recorded. So certainly we'll share the link with you and you can revisit it. The slides are also going to be available to you. After Roberta is done speaking, we will have a Q&A session. So we look forward to lots of good dialogue, lots of good questions on this very hot topic. So before we get started, I'd like to introduce you to Roberta. As I mentioned, she's the Senior Vice President of Government Programs and Strategic Partnerships. She joined Independent Health in 2005. She works to develop strategic partnerships with local, national groups, really to improve care in the West New York region, and obviously also to help keep costs at a reasonable level. Some of her past roles at Independent Health, she led state and federal programs, which included Medicare and Medicaid. Prior to joining Independent Health, Roberta worked as a senior manager at Erie County, where she worked on economic development and social services. Moved to Buffalo in 1996 from Washington, D.C., where experience included staff positions in several federal agencies, focusing on national security and arms control. Certainly, maybe a little different spin than the conversation today, but very impressive. Roberta graduated from Tufts University and the Fletcher School of Law and Diplomacy, earned a bachelor's and master's degree in international relationships. She serves as a member of the board of Go Bike Buffalo, the Independent Health Foundation, and the Buffalo Urban League and Jewish Family Services. So obviously a very impressive resume, and we are thrilled to have Roberta here today to speak on this very important topic. So at this time, I'd love to turn the floor over to Roberta, and I'm looking forward to the presentation.
Hi. Good afternoon. And I'm still getting used to this landscape of not being able to see everybody, but I really look forward to dialogue later. Thank you, Walsh Duffield, for having me and giving me this opportunity to speak to everybody. And first and foremost, I hope everybody remains safe and healthy and has enough toilet paper and paper towels to make it through the orange zone where most of us are living in right now. So today, as we look at the healthcare landscape, I think it's really important to understand that everything is good for the foreseeable future is going to be viewed within the context of COVID-19. We're going to have to address this pandemic to get our governments back and running and navigate through this storm. What I'm going to talk about today are the election results. I know a lot of you are familiar with them. I'm going to go quickly through them. What's going to happen in the lame duck session between now and the inauguration, the next Congress, what President-elect Biden, what his healthcare priorities are, the fate of the ACA, as you know there are discussions at the Supreme Court, and also touch on what's going on in New York State. As it stands now, Joe Biden is the projected winner of the election and is the presumed president-elect. If the electoral results stay the same, Biden will have beat President Trump with the same electoral margin Trump won with in 2016, 306 to 232. We do know that the president is contesting some of those, and so it's not final yet. States will be certifying their vote totals over the next couple of weeks, and the Electoral College will officially vote on December 14th, and any legal disputes will have to be resolved by then. New York seems to have shifted more Republican this election, although I must tell you that, as you could see, this shows only 81% of the estimated votes reported. But as you could see, New York went for Joe Biden statewide at 56.4%. with 84% of the votes tallied. And in Erie County, we were a little bit more leaning Republican, with Joe Biden getting 51.8% of the vote. So between now and the end of the year, the government has to fund itself. So the government is currently funded through a continuing resolution that expires on December 11th. In that, that's an opportunity for Congress to address things like COVID provisions in the final budget. But given the contested, the relationships between Congress or in Congress right now, between the Congress and the Senate, it doesn't seem likely that there'll be any big COVID relief in the December 11th continuing resolution. The Trump administration as well may issue final regulations it has been working on, such as things like international pricing index or the rebate rule for pharmacy in pharmacy. And if they do that, if the Trump administration does issue regulations, there is something called the Congressional Review Act, which the Biden administration can use to override those. That would be done through Congress, but that's something that would be considered. We have seen a number of regulations that are being set to move forward in these last days. Let's talk about Congress. And as you know, as you've seen, although the GOP had a stronger than expected showing, Democrats will hold the House, and Nancy Pelosi has been re-elected as Speaker yesterday. Several seats that were lost were in districts Democrats flipped in 2018, so they went back to Democrats. Although it's interesting to note that in those, Biden might have won, but it went back to a Republican for this actual seat. With a narrow majority, Pelosi will have less room on legislation, and she really has a really hard task of unifying the progressive and centrist wings of the Democratic Party. And so it's going to be a difficult task. On the Senate side, as you know, we're still waiting for a runoff in Georgia, but the GOP held on to several seats that the Democrats were hoping to flip to gain control of the upper chamber, like Senator Susan Collins of Maine. So we're still, there will be 2 runoff elections in Georgia in the first week of January for both of Georgia's Senate seats. If both seats go to the Democrats, then if they pick up both of those, then you'll have Vice President Harris be the tiebreaker. However, I think that the Democrats, while it looks like that they won the White House, I think there was some expectation that there would be a stronger showing in both the chambers, which didn't happen. So it's going to be a pretty difficult road ahead in terms of what Biden can do as president. There are, though, some things that, even with a divided Congress, there's still a lot of issues that that there may be bipartisan support for. COVID relief there's no question that both the House and the Senate appreciate and understand the need to provide COVID relief. There's just different priorities where there's just different priorities on where things should go here. And so the Democrat priorities are for state and local funding and unemployment and sick leave benefits. They did pass something called the HEROES Act earlier that cost between $2 and $3 trillion. The GOP, while on the other hand, They want targeted relief for businesses and liability protection for businesses. The GOP Senate did pass a bill that was equal to about $500 billion. So you have a big difference between the HEROES Act at a $2 to $3 trillion price tag and a GOP proposal at $500 billion. But you also, since those were passed, have a country that is really not going in the right direction in terms of infection rate, hospitalizations, and unfortunately deaths. As you know, even here in Erie County, as businesses have to close again, and schools have to go remote, there's questions of how to support not both the health and economy, and I think those are absolutely going to be priorities in the next Congress. With that, there are some other things that Congress will be looking at. Drug pricing is absolutely something that I think, I know that both the House and the Senate agree that there needs to be, addressed. There have been some bipartisan proposals. However, there is not necessarily agreement on how far it should go. President Trump has also put out a number of executive orders. And as I mentioned, there are some final rules sitting at the Office of Management and Budget that could be released, in fact, in the next day or two, that look at things like pegging the price of drugs to international pricing, getting rid of rebates, and things like that. So I think there will be actually renewed efforts to look at drug pricing. Telehealth. It's really interesting how a pandemic can change behaviors. Prior to the pandemic, telehealth was something we're always watching, and technology allowed for virtual visits, and there wasn't really a huge uptick. However, with the pandemic and people being home, it's really been an incredible shift, thousands of % to people moving to telehealth. And I think people are finding that in many instances, not all instances, that they could get a good visit with a physician, and they could do it at their convenience, on their time, and at home without having to go to the office. So Congress is looking at what kinds of flexibilities and how to support telehealth. Surprise billing is something you'll hear about, but not something that is really as relevant to us in New York State, because we have one of the model programs where we are using an arbitration style dispute resolution for people who are getting surprise bills, things that they weren't expecting. I know that the pandemic has also, there's been clear recognition that the pandemic has further exacerbated healthcare disparities and put a shining light on, for instance, minority communities being greatly more impacted by COVID due to lack of access, whether it be broadband, through not even having the ability to use telehealth, or not having access to the types of things that could keep them healthy and safe in their communities. This not only goes to inner city, but rural, which we are live close to here as well in Erie County. I want to talk about Biden's healthcare proposals, Vice President-elect Biden, and where President Trump has looked to, in his administration, to go to a more choice and competition with healthcare and try to allow the market forces to drive healthcare. President-elect Biden is looking to leverage and expand government programs. Remember, as vice president, he was there during the development, creation, and implementation of the Affordable Care Act. So we can expect him to expand on that and strengthen the Affordable Care Act. I will talk more about his COVID-19 strategies, but I want to talk a little bit about what he might do with respect to the ACA. He is looking to increase premium tax credits and reduce out-of-pocket cost sharing by setting the benchmark plan at the gold level. In the Affordable Care Act, the premium tax credits are set to the benchmark plan at a silver level. He's looking at setting that at a gold level. He's also looking at increasing the number who are eligible for premium tax credits by eliminating the 400% income cap on tax credit eligibility. So, and lowering the limit on the cost of coverage from 9.86% of income to 8.5%. So remember, in the Affordable Care Act, the idea was to ensure that people weren't paying more than a certain percent of their household income on health insurance. And those people who are going into marketplace coverage, the subsidy and or cost sharing that they were eligible for was based on household income. And so those people who are getting subsidies currently are at 400% of the federal poverty level. What the vice president is saying is that anybody, whether you get employer coverage or marketplace coverage, you should not be spending more than 8.5% of your household income. Now, again, there's not a lot of details on what this does to the employer mandate and all those kinds of things. But it does suggest, and it did say that if, for instance, you're offered employer coverage and it's greater than 8.5% of your household income, that you could get a different individual plan. So he would also look to establish a public option that would be eligible for premium assistance that will compete with private insurance. Again, not a lot of details, but we do know that in there that this is really targeted towards those states that did not expand Medicaid coverage for those people up to 138% of the federal poverty level. New York State is an expansion state. We are covering people up to 138% of the federal poverty level, and in fact have the essential plan for people up to 200% of the federal poverty level. The public option would be available at no premium to those people in non-expansion states, and we will look to see more detail on what that is. Medicare. On Medicare, he's looking to lower the eligibility age to 60. So those age 60 to 64, you can keep your coverage, but if you don't have coverage, you can also buy into Medicaid. And importantly, what I did see, and again, all the details aren't out on this, but the expectation is that this Medicare coverage for those between age 60 and 64 would not be funded through the Medicare Trust Fund. He would also look to allow Medicare to negotiate drug prices and add vision, hearing, and dental to the Medicare benefits. I want to now move to, because I think this is the centerpiece, this is the priority that President-elect Biden has when he comes into office in January and is beginning now, as you know, developing a task force for COVID. What we've heard so far is that he is going to leverage federal government to create uniform CDC guidelines for states and create a national strategy. The Trump administration has addressed COVID, allowing states to do what they think is best, I think what Biden is coming in, and he will look to create uniformity across the different types of coverage, testing, and treatment across the states. And so that will allow some more consistency. With respect to testing, they're going to look to use the Defense Preparedness Authorization and ensure that testing is free, and heavily invest in contact tracing and target at-risk areas. Call for a nationwide mask mandate. Now, when he calls for that, it's not clear that there's legal authority to make sure everybody wears it, but I think that the idea here is to create some sense of acknowledgement and leadership that wearing masks are really important, and leverage the Defense Production Act to make PPE available. Vaccines, we've had some very exciting news this week about the potential availability of vaccines, and I expect that the Biden administration will look to invest more into this, as well as what's really important is the manufacturing and distribution of the vaccine. It's not easy. While we like to, I think it's really amazing that the news of getting 95% effectiveness from the vaccines from Moderna and Pfizer is great news. It's not so easy to manufacture millions of doses and to get the supplies and to also distribute them. As you've heard, Pfizer requires deep freeze for its distribution, while Moderna more definitely freezing, but not the deep freeze. And so I know that we'll look to, the next administration will look to how to get people access to these vaccines. Financial relief, providing funding for small businesses for COVID-19 costs. I think they'll look at how the PPP program went and how to build on that. I know that Governor Cuomo is very excited, waiting for funds for states and localities. This funding is in the HEROES Act that the House passed, and I think that that's something that new administration would support. And also providing increased unemployment and sick leave benefits. Finally, as you know, that the Trump administration did pull out of the World Health Organization's efforts, and I believe that the Biden administration will be part of that and say that we want to work with other countries to try to impact COVID. So given that we talked about due to the congressional inaction on healthcare during the Trump administration, because they tried to, as you might recall, overturn the ACA, and also tried at various levels to try to introduce bills on healthcare. Trump then relied on executive orders and regulatory action. He expanded non-ACA compliant plans called short-term limited duration plans and association health plans, which were not allowed in New York State. Narrowed the open enrollment window and cutting funding for outreach and enrollment. These things I believe that the new administration will look to overturn or roll back. The Trump administration approved Medicaid waivers like work requirements, and also public charge determination, which basically says somebody who is an immigrant to the country and is using and is accessing Medicaid, that kind of information will be weighted against them, if you will, when they look at their status. There's also things that the Trump administration put into effect, like anti-discrimination protections in lieu of religious and moral objections. So the Trump administration basically said that providers that were not comfortable or had moral objections to treating certain people, that they could These things will be rolled back. But there are some things that the Trump administration did, some regulations that the Biden administration will look, I think, to build on. Interoperability rules. This is really, really important. This is something where your the data highway will include that you'll have access to your clinical data, your health information, and that data will flow throughout so that you can make better decisions, providers can make better decisions. Importation of prescription drugs, telehealth, and COVID flexibilities. There are a lot of flexibilities like telehealth that were put into regulation that I do believe the Biden administration will look to support and continue. So I want to switch go now to the Supreme Court and the hearing that took place on November 10th regarding the Affordable Care Act. So let's go back a little bit to 2012 when the Supreme Court declared the Affordable Care Act constitutional. They upheld the ACA in 2012 on the basis that the individual mandate was a constitutional tax imposed by Congress. And this tax was equal to about a minimum of $365. That was the one big thing that the Democrats really, towards the end of the Affordable Care Act development of it, were really squabbling over how much that should be. Remember, the mandate is so that people couldn't just opt out of healthcare, because the more people you have in the pool, the better the pool is. And you all realize that. But there was a lot of sentiment that the individual mandate was forcing people to do something they might not want to do. In 2017, the Tax Cuts and Jobs Act was passed, and that actually zeroed out the dollar amount for the mandate. So while the individual mandate never went away, the actual penalty did. That caused Republican governors, attorney generals, to sue, arguing that the mandate, because it didn't have any dollars associated with it, was unconstitutional. So the hearing in November took place, and during oral arguments, it seems unlikely that the court will throw out the entire Affordable Care Act. Justice Roberts and Kavanaugh made it clear that they're opening to severing the individual mandate and leaving everything in place. There are a number of possible outcomes. The court may throw out the case by declaring that the plaintiffs do not have standing, avoiding the constitutionality question. In other words, they will not be harmed. The court may declare the individual mandate is still constitutional, even without a tax penalty, leaving everything in place. The court may declare the mandate is now unconstitutional, severing the mandate and leaving everything else in place. And they may declare the mandate is now unconstitutional, severing the mandate and declaring that other provisions must also fall. So there are a number of different scenarios, but it seems from the arguments that were made that it doesn't appear like the justices are going to dismantle or throw out the Affordable Care Act, because they do believe, and I think they're seeing that even without the mandate, the Affordable Care Act, the intention of Congress is to maintain it. So turning to New York, let's look at what took place during the election. There are still votes being counted across New York, and final results are expected soon, but there are delays. So it looks like, though, as of now, that the Assembly is going to maintain its supermajority of about 107 Assembly members and Democrats, and the Senate could actually also have a supermajority. We're still waiting for a couple of votes to come in, but there's no doubt now that both chambers will have Democratic majorities. The question now is, will the state Senate have a supermajority? Just to note that Governor Cuomo, the governorship is up for election in 2022. Senator Schumer is up for re-election in 2022 as well. And Senator Gillibrand is up for election in 2024. In New York, New York is really facing a tremendous budget deficit. It was facing a budget deficit prior to the pandemic, and that's only gotten worse. So pre-COVID, they were facing a $6.1 billion deficit in 2021. And post-COVID, we now see about a $14.9 billion deficit, with a 5-year deficit looking at $62.8 billion. Now, prior to COVID, the budget crisis was seen largely due to Medicaid and a lot of that long-term care. So Governor Cuomo had a Medicaid task force that had some proposals that they were looking at. And while some of those are being instituted, there still needs to be a lot that happens here. Governor Cuomo is banking on the federal government coming through with money for state and localities, and that can come soon enough. What's interesting to note too about Medicaid and the Essential Program, the state expects an increase of around 1 million Medicaid members and an additional 800,000 Essential Plan members. So this is going to have also a lot of downstream impact on providers, because as we know, Medicaid pays less than commercial and or Medicare. And so this is going to be a real impact that's going to have to be addressed. Navigating through COVID, Governor Cuomo, since the public health emergency was declared here, has issued more than 80 executive orders that give him a lot of power to address COVID. And I think there's been a lot of commentary on how he has handled this, but he has really trying to take advantage of this to ensure that New Yorkers remain safe and healthy. New York, as you know, was struck early on, and Governor Cuomo took the reins and is continuing to issue these executive orders. He has been recently out there with the vaccine distribution. He has a phased approach for that, making sure that first responders get that, and people who are compromised as well, elderly, trying to ensure that those people get the vaccine first, as well as those in underserved communities. So he has put out a vaccine distribution plan. Also during this, as he saw in summertime, New York Forward restrictions and advisories created a whole guidelines and policies on how New York can open. It was originally designed as a reopening plan due to the increase in COVID numbers. And it's safe to say it's recently being leveraged for implementing restrictions, maybe in New York backward. But I think it gives us that feeling of, when things get worse, there's a plan. So that's what New York State is doing. I wanted to kind of end this slide on talking a little bit about independent health and what we've been doing to support COVID right now. because I have to say that, you know, Independent Health, Dr. Kropp has been very much supporter of providers, and when this first hit, recognized that providers' offices were closed, people weren't going in, and we reached out to all our providers, especially our primary care physicians, and made sure that their cash flow was similar to levels in a typical month from the year before. So April, May, you know, those months, what were they doing the year before? We wanted to provide stability for them to make sure that they remain stable during this, and switched obviously to supporting telehealth. And we also in the community, we worked with our foundation to ensure that people were getting food and personal health, the PPE throughout our community, and especially those hardest hit. We also offered something called Brook Health Companion to people free in the community to allow access to experts to help them through specific COVID questions. So I wanted to stop there and hand this back to Mike and the team there for any questions.
Roberta, thank you very much. That's a lot of information. It seems like we probably could have this type of meeting quarterly going forward. So thank you very much. What I'd like to do right now is turn it over to Stephanie, and then Stephanie's going to run the Q&A. I see we have a couple of questions in the queue. So Stephanie, take it away.
Thank you, Roberta, and thanks, Mike. Yeah, we've gotten some good questions here. So Roberta, the first one that we received was, can you provide a reasonable timeline for individuals to receive a vaccine once it's available? And I know you talked a little bit about it, but what about for, you know, individuals that maybe aren't part of the front line or, you know, higher risk? What do you see as the timeline?
That's a great question, and I'd love to be able to give you a great answer. But from what I'm seeing now, given you know, the issues with distribution and production and distribution, I wouldn't look to anything until spring, summer at the earliest. And remember, these are 2 doses as well. Both the Pfizer and Moderna are 2 doses. However, that being said, Operation Warp Speed that President Trump initiated has other pharmaceutical manufacturers that could come up with something else. So from what we know right now, I would say not until sometime in the beginning next year, half of next year.
Okay. So how likely is it that Medicare eligibility will be reduced to age 60?
I'm not sure. I'm not sure that kind of thing is going to be likely. I think that's an aspirational thing, depending on what happens in the midterm election, because with a divided Congress, it's pretty unlikely, as if Mitch McConnell remains speaker, that you're going to get any major changes in healthcare like that.
Okay. So do you anticipate the FFCRA being extended? Right now, its current end date is December 31st.
I'm blanking.
That's the Families First Coronavirus Response Act.
Right. Well, so there's really great concern over this, and I think you know, December 11th, when Congress has to pass either a continuing resolution or agree on a budget, there is an opportunity to address some key elements of that. But I think, given where we are in Congress right now in this environment, we might have to wait till the beginning of the year, till the next Congress, but they could also do things retroactively as well.
Okay. So, and I guess this is a question for you to put your carrier hat back on. Is there any foreseeable downside with telehealth? For instance, do you foresee more serious diagnoses going undetected as individuals move to a virtual platform for their healthcare services?
That's a really great question. And we are discussing that discussing that now. And I think we're trying to understand, what are some of those barriers? What are some of those things that might go undiagnosed? And what's the quality of the experience that people will have? Because, there are a lot of things. Yes, it's great to be convenient, but sometimes there's missing that in-person touch point, real touch point, can miss some things. And also there can be abuses of this as well. So we're trying to figure this out. So if people do have experiences that are either good or they see problems, it'd be great to understand that.
Well, thank you. And that was it for the questions. My contact information is on the final slide. If anybody thinks of anything else, please reach out to us and we'll get the answers to the questions. I'm going to turn it back over to Mike just to close us out. Thank you.
Well, first, let me thank you, Roberta. That was great information. I think we can all agree that hopefully 2021 is going to be a better year than 2020. We will someday look back on it as one of the most interesting years of our lives. I hope everyone enjoyed the presentation, and we certainly invite you to future educational webinars, which you can find at wallstuffield.com/webinar. If you have any additional questions, please contact your Wall Stuffield representative, and we can get you answers. I think this is a great topic to maybe even reconsider revisiting at the end of first quarter. I think we'll have more clarity in what President-elect Biden's plans are for healthcare, and certainly we'll have a better understanding where we stand with COVID. So I know I'm keeping my fingers crossed that 2021 turns out to be a very good year for all of us. So with that said, thank you very much, and enjoy your day, and everyone have a great Thanksgiving.